How are you? My name is Alice Munyua. I am a nurse practitioner, and today we're going to talk about the number one killer of humans. But actually, to be honest with you, this is the number two killer of humans. And usually it's heart disease, heart and vascular disease. But the number one killer of humans is actually medications. You know, the medications that we use to treat, medical treatment is the number one killer of humans. That kills more people than the actual diseases that they suffer from. So let's talk about the number two killer of humans. But in the whole list of all diseases, it is considered to be the number one killer of humans. That is heart and vascular disease. But today we're actually going to go a little bit deeper and talk about something that's called a cardiometabolic syndrome, which is, it puts you at risk for death, really. And what is that? What is a cardiometabolic syndrome? Cardio means your heart. So your heart is involved. And metabolic means there is something with your metabolism that's going on. So I know it's a big word, but if somebody has this syndrome, the risk of dying from it is very high. What is metabolic syndrome? Metabolic syndrome is when you have something like type 2 diabetes, because type 2 diabetes is actually an inflammatory disease, and it affects more organs than one. Most people think it's just a blood sugar disease, and we tell people usually to lose weight, to control their blood sugar, to eat well, but we never really dig a little bit deeper to find out what the root cause is. The root cause of type 2 diabetes is inflammation, and it affects more than your pancreas. It affects your liver, it affects your blood vessels, and it continues to affect your kidneys, your eyes, your brain, all that good stuff. But what is cardiometabolic syndrome? Cardiometabolic syndrome means you have this type 2 diabetes. You also have maybe cholesterol, high cholesterol, and you probably also have high blood pressure. So do you know anyone like that? Somebody who has high blood pressure, somebody who has type 2 diabetes, and somebody who has high cholesterol. That is cardiometabolic syndrome, and that puts you at risk of death because there are so many things that are wrong here. And usually the root cause is still inflammation. If you know what the word inflammation means, the root word for inflammation is flame. That means there is a fire. There is a fire burning within that's causing all these problems. And actually, for those people who are worried about coronavirus, this kind of syndrome will weaken your immune system. So the best thing is to get to the root cause of it, deal with that, and you'll find that your health will actually get better. You will feel better, and some of these diseases, even the type 2 diabetes, could get a whole lot better. And that's where I help people with. That is the kind of help I help people with, because when we treat you, we will give you the insulin, we'll give you the medication for type 2 diabetes, you know, your metformin, all that, your other drugs that we give you. And we also may give you long-acting insulin. But none of those drugs actually are dealing with the root cause of the problem. What we are treating when we do that, even the blood pressure medicines that we give you, we are treating the numbers, and we are also treating the symptoms. That's all we are doing. When we give you medication, the statins that we give you to control your high cholesterol, it never gets to the root cause. So if treatment is better, it's good if you want to go to the doctor, but it's not the only thing. There's a better way. And with that better way, I want you to get this little book of mine. The book says, Think and Grow Healthier, A Balance Between Spirit, Mind, and Body. And if I can help you get to the root cause of the problem, when you have high cholesterol, that one is actually easy to fix. High cholesterol is easy to fix. If you have high blood pressure, that is also very easy to fix, because high blood pressure is coming from somewhere. And normally there's nothing wrong with your body. There is no organ that is diseased, but your blood pressure is high. So we get to the root cause of that. And then we can also get to the root cause of type 2 diabetes. And if you're pre-diabetic, that is even a good time to get in touch with me so I can help you reverse that, so you don't end up having the actual disease. When you have pre-diabetic, there are some things you can do, and it actually has nothing to do with diet, funny enough. It has nothing to do with diet, but there's obviously something that you're doing wrong to have this condition. So get in touch with me, and if you want, you can go to my website and actually purchase this book, because the things that we'll be talking about, most of them are in this book. If your condition is too difficult for me to help you, I can help you get a team of people who help people get to the root cause of diseases. And once we get to the root cause of a disease, you will be able to get better. Healing. I know most people don't believe in healing anymore, but healing is there, and it is possible because our bodies are able to heal themselves. Did you hear that? Our bodies are able to heal themselves. So good luck and get in touch with me. Thank you.